According to the American Sleep Association, at least 40 million Americans suffer from chronic long-term sleep disorders, and an additional 20 million experience occasional sleeping problems. ABC News medical editor Dr. Tim Johnson is on call with some natural snooze solutions to help you get a better night's rest.
Our subject is sleep and sleep problems. Our guest is Dr. Svetlana Kogan, who is board certified in internal medicine, affiliated with Lenox Hill Hospital in New York, and a member of both the American Medical Association and the American Anti-Aging Academy. We welcome you to the program, Dr. Kogan.
Thank you, Dr. Johnson. I'm glad to be here.
Let me begin by asking you to define sleep problems versus actual insomnia, and then talk a little bit about the magnitude of these problems.
The magnitude of the problems is huge. Over 70 million of Americans are experiencing one form of sleep disorder or another. Sleep disorders come in all kinds of flavors. You have people who have difficulty falling asleep. You have people who are experiencing difficulty staying asleep. We've got people with sleep apnea, people who are waking up in the middle of the night short of breath, people with nightmares, and people with night terrors. And as we all know, not being able to get a good night's sleep leads to a variety of medical problems, starting from decreased immune function, continuing to worse mental alertness, inability to focus, decreased work performance.
When do you decide technically, or in terms of definition at least, that it's so-called insomnia?
If inability to fall asleep causes you to get less than 6 hours of sleep per night, and you're starting to experience more frequent infections, decreased mental alertness, inability to perform well at work, you should address this with your doctor, especially if this becomes an everyday event.
And should people who have these kinds of everyday problems go to their doctor and then insist on a sleep study and a sleep lab, an overnight sleep study?
Not necessarily, doctor. Most of the people can figure out the root of the problem by having their doctor take a very good and thorough history and performing a good medical exam with all the appropriate diagnostic tests, sometimes blood tests as well. For most people, their story, their life story, is usually the root of the problem. Some people are breastfeeding mothers who have to get up in the middle of the night and feed the baby. We have stressed out fathers, the breadwinners who are in danger of getting fired and stressed out about the project deadline coming up. So everybody has a story, and I think it takes a good clinician, and we hope that all of us have good primary care doctors, to identify what is this particular person's story, what are they so stressed out about, why can't they relax and fall asleep on time.
And let's talk about the role of three commonly used drugs in our society: alcohol, tobacco, nicotine, and caffeine.
Sure. Well, we definitely advise our patients to avoid these stimulants. As we all know, alcohol, caffeine, and nicotine are stimulants, and we highly recommend that people do not use any alcohol or caffeine several hours at least before they're intending to go to sleep. And obviously smoking is out of the question. We urge people to stop smoking.
For many good reasons,
For
obviously.
many reasons, yes.
All right, let's talk about the role of over-the-counter sleep aids and prescription sleeping pills. When and if they should be used.
Personally, I do not believe in a quick fix, although, of course, as an MD, I get visited by a lot of patients who desire that quick fix. They want to take something either over the counter or by prescription to instantly put them to that magical sleep. I do not like prescription drugs because of both their side effects, and there are many, and their cost, and also their potential for addictiveness.
What can you do short of those kinds of pills?
We work on teaching our patients how to relax in bed. We teach them good hygiene, sleep hygiene techniques. We provide natural supplements, things that contain chamomile, valerian, lemon balm. We also teach them how to breathe properly. We provide acupuncture services as well as massage services, and as a result of this individualized approach, because we don't have the same cocktail for everyone, everybody gets a different holistic prescription, so to speak, most of the people are able to avoid taking prescription medication.
And you have some tips in a certain order for us, so let's run through them.
Certainly.
Some of which you've already mentioned, but to just sort of summarize the natural approach, if I can use that word.
Sure, sure. I think one of the important things about the holistic approach is to teach our patients to breathe properly. Focusing on your breath can take your mind off a lot of your daily stress and problems. The person has to place the tip of their tongue behind their upper teeth, and we have to take a deep breath through our nose on the count of 4, kind of like this. We then hold that breath on a count of 4 and exhale through the mouth on a count of 8. So the exhalation is twice as long as the inhalation. We also recommend that people drink herbal teas or take oral supplements which contain some of the time-tested natural ways to relax your nervous system. We usually recommend chamomile extract. We recommend lemon balm as well as valerian root. We do also recommend that people drink these about half an hour before they want to go to sleep.
Okay.
Whether it's in an oral form or in a tea form.
And your next tip says no TV, blackberries, etc.
Yes. Our nervous system is extremely excitable, and any kind of stimulation, whether it's visual or auditory, will do nothing but, hyper-excite our sympathetic nervous system, and then we're definitely not ready to go to sleep. So what we should try to do is about an hour before we're ready to go to sleep, we have to make a commitment and turn off that TV. What a terrible thing to say on TV.
That's all right.
We should turn off our computers and blackberries, and we should try to to put our mind to peace. Have a peaceful conversation with our significant other. Take a shower, take an aromatherapy bath. There are so many ways we can relax.
All right. Well, a lot of good tips and good advice. We do thank you very much for taking the time to join us this morning.
It is my pleasure, Doctor. Thank you.